afternoon. I am happy to get started. Sorry, folks, I was a little bit late due to some tech issues and another meeting, so really appreciate the patience. But welcome, everybody. We're so happy to have you. And for those that don't know, my name is Shamia or Mia. I am Acting Viral Hepatitis Program Director with the state. I'm really excited to see everyone this afternoon. So we are going to start with some introductions and announcements. Then we will go into a brief didactic presentation by Melissa Moon on rapid hepatitis C testing and community-based partners in the state. And then we are going to go through some pediatric case presentations, a Q&A, and quick closing remarks. Before we do that, just a quick reminder to please either scan the QR code or use the link to register through Southeast Age Education and Training Center. They have a great deal of resources, as well as will be the one helping with your continuing education credit for those that are interested. And we will work on getting that link added to the chat for you as well. Some quick introductions we will do in the chat. Next slide. So before we get started, if everyone will take a second, it looks like some people already are introducing themselves and their role and organization and whether or not this is your first echo session. Thank you, Claire, for adding it to the chat. I was trying to copy it and it wasn't working. So Claire just dropped the registration link for Southeast Education and Training Center. Like I said, that'll be tied to your continuing education credits, as well as some amazing resources for not only viral hepatitis, but HIV as well. Excited to see some folks introducing themselves in the chat. We can go ahead to the next slide. So we're going to move into our didactic presentation where Melissa Moon, our viral hepatitis community outreach coordinator with the state of Tennessee, will be talking more about some of the rapid hepatitis C testing and community-based partners that we have throughout the state and some of the services that are offered before linking folks to treatment. So Melissa, I will pass it off to you.
All right. Thank you, Mia. Good afternoon, everyone. Again, my name is Melissa Moon, and I'm the Viral Hepatitis Community Outreach Coordinator for Tennessee Department of Health. So I have no financial disclosures or conflicts of interest to report. All right. So for the viral hepatitis rapid testing program, we use the OraQuick hepatitis C rapid test. So OraSure Technologies released this test in June of 2010, and it became CLIA waived in 2012. And from putting all this data together and research, I saw that Tennessee Department of Health started doing rapid testing with community-based organizations in 2015. However, some of our community-based organizations started doing testing in 2013. This test is FDA approved. Again, it is CLIA waived. It has a 98% accuracy rate. You would use either a finger stick or whole blood to get the blood for the sample, and then you will have results in 20 minutes. If a CBO or another agency, whoever it may be, if they also have the OraQuick HIV rapid test, they can run these tests side by side and have one finger stick and 2 test results in 20 minutes. There are some rapid testing project goals, of course, we have with our community-based organizations. The first one, of course, is to educate. We want to educate our clients and the community on what viral hepatitis is, how it is spread, how to identify if you've been exposed to hepatitis C, and then strongly encourage the confirmatory test for individuals who are hepatitis C antibody positive. And we also want to increase awareness of harm reduction services for clients, such as mental health services, substance use treatment, HIV testing, and or other STI testing. With this test, though, there unfortunately are some limitations, as this test can only determine if someone who has been exposed to hepatitis C. It does not tell if they are currently living with hepatitis C, if they have cleared hepatitis C on their own, or if it's been resolved, if they were successfully treated, or if an individual is in the window period. After being exposed to hepatitis C for the antibody, it can take up to 6 months to show up on the rapid test. It's typically within the first 3 months, but it can take up to 6 months. And this test is also not approved for individuals less than 15 years of age or pregnant persons. We have 20 different partnering agencies across the state, and with that, there's 25 different sites across the state, as 5 of our partnering agencies have 2 different sites. Like SIMPA has a site in Chattanooga, and they also have one in the Northeast region. Choice Health Network, also known as Positively Living, they have a site in Knoxville, Tennessee, and then a site also in Chattanooga where they do testing. Free Medical Clinic has a site in Oak Ridge and Harriman, Tennessee. And then McNabb Center has a site here in Knoxville. Sorry, I say here in Knoxville because that's where I'm located. But also they have their rural recovery van that goes to 5 different counties in the state. And then we have Meharry also that has 2 different sites in Nashville. Several of our agencies operate in a brick and mortar site, but they also operate in a mobile setting as well, because they have mobile vans or mobile buses to go and operate rapid hepatitis C testing. 2 of the sites, Buffalo Valley and McNabb Center, they operate with the Project Rural Recovery. And like Buffalo Valley goes to 5 different counties each week in the southern middle Tennessee area, where McNabb goes to 5 different counties in the East region each week. So we're trying to get testing spread out and to get the state covered, but we do have some gaps in Tennessee. With the rapid testing, we offer this testing at different outreach sites and settings. As you can see from this list, there's several different settings that this is offered in, and all of the rapid hepatitis C testing is offered free of charge to clients. Some of our partners also operate syringe service programs and offer this testing alongside with their other harm reduction services, such as the syringe exchange or other testing or passing out condoms, whatever harm reduction service they may offer. A few of the partnering agencies are operated in health clinics for low income and or uninsured clients and offer the rapid hepatitis C test as their first step to get their clients treated for hepatitis C. So they'll test with this rapid test. If it comes back positive, they will offer the confirmatory testing on site, or they will send to a lab to get that done. If that comes back positive, then some of these clinics will actually offer the Hep C treatment there for these clients. A few of the agencies, like I did say, do offer the Hep C treatment. With these different testing settings, we are reaching multiple individuals that have very limited knowledge of hepatitis C, or would even think that they would need to get tested. So you can see from these events, like we've done testing at RAM clinics, we've done testing at Pride events, health fairs, overdose awareness day events. We offer testing sometimes at the day reporting centers with Tennessee Department of Corrections or the reentry resource fairs. And we've also done testing at a couple of NASCAR race events. From this map, you can see the 2022 hepatitis C rapid testing data. So in 2022, we tested 5,373 individuals. 1,083 of those were hepatitis C antibody positive with a 20% positivity rate. 1,021 of them were referred for the second test. And then you can see here that 259 got the RNA testing, and 438 had any type of hepatitis C RNA testing. In 2023, you could see our numbers increased a little bit for the testing that was conducted. We had 5,982 with 1,190 with a hepatitis C antibody positive result. So again, right at a 20%. But now in 2024, of course, this is where we're at. So between January 1st and April 30th, now again, this is raw data, we've had 2,382 rapid hepatitis C tests conducted. 360 of those have been antibody positive, and that calculated to a 15% positivity rate. If we were to stay on track with the current testing that we're doing with our agencies across the state, we are set to test more individuals this year, which will be great. With the hepatitis C testing project, we don't just give test kits to agencies and say, all right, stick their finger, run it for 20 minutes and tell them if they have an antibody positive result or antibody negative result. We offer rapid hepatitis C testing trainings that all of our partnering agencies attend, and anyone who's going to test at their agency. So in 2022, we had 13 trainings, conducted. 72 participants were trained. In 2023, we increased to 14 trainings that were conducted and 112 participants were trained. And then 2024, from January through the end of April, we've already done 5 rapid hepatitis C testing trainings with 40 participants trained. Our next rapid hepatitis C testing training will actually be Monday, June 10th at Free Medical Clinic, Oak Ridge. If an agency needs trained, it's offered to all agencies or their participants if they're able to travel to that area. We do have several more that will be lined up for this summer all across the state, though. This training, it does review what hepatitis C is, how it is spread, how to prevent hepatitis C, how to operate the hepatitis C test kit and controls, and how to provide the post-test counseling to clients and where to go for that second test. This is just a little overview right here that shows like all the steps to becoming a partner with Tennessee Department of Health viral hepatitis program to offer this rapid testing. Again, all individuals that are going to test have to go through our training. And not only do they have to go through our training, they have to pass our training with a post-test score of 80% or higher, because we do want individuals who know what hepatitis C is and all the ins and outs of it when they're offering this testing to the community. With the training, we also do on-site site visit. Every agency has the initial site visit, and then there's an annual site visit that I do every summer. So I will go to all 25 agencies this summer and visit with them for 45 minutes to an hour and go over the site visit checklist and make sure we're still meeting all those requirements. The rapid hepatitis C testing partners also, when they test, they have to do monthly reporting, and then they also attend quarterly calls, and we send progress reports every quarter. So this goes in a little bit more detail of what it takes to become a partner for the Rapid Hepatitis C testing program. Every agency has to have an active CLIA waiver. They all have to have a no-cost contract between us, the Tennessee Department of Health Viral Hepatitis Program, and their agency. They also have to have a medical laboratory board form signed by a medical physician and with a copy of the physician's medical license. Again, all staff volunteers that will touch the test kits have to go through the rapid hepatitis C testing training. Again, we do the site visits, the initial visit when they first come on board, and then the annual every summer. All of our partnering agencies do have to report monthly to us their aggregate data, and they also submit their hepatitis C antibody screening tool forms for all their hepatitis C antibody positives. And then we do have it required that all of our agencies have to attend the quarterly calls, because that's when we go over information that may have changed, such as we used to have MOUs for our partners, and then we switched to the no-cost contracts. So we used a quarterly call to review that information. We also review if there's any change in the distribution of test kits or controls, like we used to ship from central stores and now we ship directly from OraSure. So those calls are just important as we can review known stuff already just to help remind them, and then also review any new material or changes that have taken place with the program. At the site visits, these site visits they're pretty simple. We have a checklist that we give the agency and say, these are the things that we're looking for and that need to be met, such as anyone who's gone through the rapid hepatitis C testing training. We need to see their certificates from the completion of the training. And we also need to see the colorblind test documentation as well. And they would have this in a binder. And with that, they will have a checklist on each staff or volunteer that's going to do the testing, showing that they've been checked off to do the training, such as they showed how they were competent in running controls and competent in the education of hepatitis C. We also look for where they're going to store their test kits, where they're going to store the controls, keeping a temperature log of where the test kits are stored on a daily basis and in the fridge where the controls are stored. We also ask to look at a control log where they've ran controls on new shipments of test kits, or if there was a temperature failure in the building, like in the summer, if the air has been out for several hours, we ask them, once they get the air fixed, you bring your temperature up to like baseline, 70, 60, whatever the agency keeps their temperature at, and then run controls to make sure those test kits were not harmed during the temperature failure. We also look for their biohazard procedures and go over that with them. And we look for the confidential storage of testing records and logs, such as any of the records need to be stored between 2 locks, such as in a filing cabinet that locks, which is in an office that locks. Most of our agencies, they're almost stored between 3 or 4 locks. So that's great. And it's also, the site visits are also just a good time for me to catch up with them, to see if they have any questions, if they have any suggestions, or just get to know the agencies better. With the hepatitis C monthly reporting that the agencies do every month, so for May's report, all of my May 2024 reports will be due June 15th. And they submit these in REDCap. The data that is required are the total number of tests conducted, total number of positive tests, and with the total number of positive tests, they also have to upload the positive hepatitis C antibody screening forms, which I'll show you on the next slide. We also need to know all the genders of everyone that was tested that month, their ethnicity, their race, and any self-reported patient information such as past or present drug use, past or present incarceration, tattoos, born between 1945, 1965. That's just a few of the things that we ask the clients to tell us if it's a yes or no. And then the agencies also report on what counties they did testing in, because some of our agencies, again, offer mobile testing. So they go to several different counties or surrounding their location, or some are just fixed and they just do testing at their brick and mortar location. So it just varies, but we do want to know what counties the testing was conducted, because again, we are trying to increase testing across the state. And then we also have them report their test kit inventory and their control inventory with their expiration dates as well. This here, I know it's a little small, but this is the hepatitis C antibody screening tool that we ask the agencies to send us on all of their positive cases. It gathers all the information that we need, like we do on a positive. We have to have their first name, their last name, their date of birth, their gender, their race, their ethnicity, and then whatever self-reported exposures they may have. So we just ask them to fill this form out completely and